on there, Waziri. And of course, the bigger question right now is in regards to the logistics. How will this be handled? Do you have the capacity? Do you have enough trucks to supply the vaccines across the country? Do you have plans to talk with the counties?
Thank you. That's a very good question, Abby. We recognize that really it is a mammoth task. We've been watching different countries in terms of the progress that they're making, and indeed, this is not going to be an easy task. In terms of logistics and infrastructure, we have a plan set out. We've thought about the current infrastructure we have in the country, and one of the key principles that we will be deploying is that we are going to use the existing infrastructure as much as possible in order to be able to really leverage on those efficiencies that exist. And Kenya, for a very long time has been a country that has been undertaking vaccinations. We've been able to deploy a wide range of vaccinations and even introduced new vaccines. I'm sure you're aware of the HPV vaccine for girls over 10 years of age and many other vaccines that have been newly introduced in Kenya's vaccine schedule. And so Kenya has experience when it comes to introducing new vaccines, and we will be leveraging on that experience. In terms of infrastructure, I think the first point, every time you're discussing an immunization program and discussing its requisite infrastructure, the first thing is, where are people going to be vaccinated? Where can a Kenyan walk in and find the vaccine ready and available for them? And what we're planning to do is, particularly in our first phase, we've been able to ready about 400 facilities across the country. And these include both public facilities and private facilities. We'll be looking at our level 4 hospitals. These are the county referral hospitals, our level 5 hospitals, as well as our referral hospitals and other, same level tier private facilities. And that will be the first point where you can get your vaccination administered. In terms of knowing, as a Kenyan, how do I get there? Will there be a list or a schedule with my name? We're going to be utilizing different logistic information systems. We have one known as Chanjo, and Chanjo will be able to really administer for us the rollout of this vaccine. As a Kenyan, you'll be registered on Chanjo. You'll be given a date when you should present yourself to the facility. When you get to the facility, the healthcare worker will be waiting for you, and they'll be able to administer your vaccine. One of the important things to remember, and really, we're requesting each and every person in the country to be well aware, particularly those who will get the vaccines, is that you require 2 doses for this vaccine to be able to be effective. And so because you require 2 doses, upon presentation at the facility for your first dose, we'll be able to take your records, your information, and to be able to schedule you to come back for the second dose. And so phase 1 really is a focus on these 400 facilities. When we look at our cold chain infrastructure, which is a very important part, because these vaccines can only remain stable under certain temperatures and therefore can only remain effective if held under those temperatures. We've been able to do assessments of our current capacities in the country. And we're happy to say Kenya has close to 10 huge regional stores, that help us to store these vaccines once they come into the country. And these stores have the requisite infrastructure when it comes to the cold rooms and the freezers and the refrigeration. And we've been able to, determine that in Kenya, we can actually comfortably deploy a vaccine that requires to stay between 2 to 8 degrees centigrade in terms of positive temperatures. In terms of negative temperatures, we can get to negative 20 degrees centigrade. And when we look at the current vaccines that are available, particularly those that have already been pre-qualified by WHO, then already we can see that the AstraZeneca vaccine would be one of the ones that we'll be relying on because of the cold chain temperatures that it requires, as well as the Moderna vaccine, which can be able to be stable at negative 20. So as it stands right now, in terms of infrastructure, we are ready to go. Should we want to deploy Pfizer, should we be able to pick that as a candidate, we will require to invest a little bit more when it comes to, negative 70 degrees cold chain storage facilities. And that is a discussion that is underway to be able to determine perhaps this vaccine requires to be deployed in urban areas where that capacity may be available, as opposed to perhaps rural areas where the capacity that is there is that of 2 to 8 degrees centigrade. And then the most important thing, of course, is then logistics, moving the vaccines from the depots to the counties, to the sub-counties, eventually to the health facilities. And again, we'll be using the current infrastructure that we utilize, partnering with KEMSA, partnering with private sector to ensure that that logistic chain is, foolhardy from point of delivery all the way to the healthcare facility. And then, of course, perhaps what I would consider as a doctor most important would be the safety and the monitoring the effects of this vaccine. We have a very agile, robust monitoring and evaluation framework. Kenya has always adopted mechanisms to be able to assess vaccines and to look for any adverse effects that may come out. And so we will be rolling out such a structure, starting all the way from national government to the health facility. This will require a lot of engagement by county health officers, particularly the technical teams who conduct surveillance at the county level, as well as our faith-based organizations and CSOs who have long supported us when it comes to immunization. And so part of the questions that we will be asking will be, did you get a vaccine? Did you get a fever thereafter? Did you have any side effects? Have you been able to return to work? And all this data will be collected and, analyzed on a day-to-day, almost on real-time basis, so that we can ensure that every Kenyan is getting the vaccine in a manner that is safe and that we don't have any adverse effects. So there's a lot going, in the background, a lot of machines and clogs all working to ensure that the country delivers the vaccine in a manner that will be safe and effective for all.
All right. Dr. Masi, the